right now I want to bring on the Chief Operating Officer of Neon, Miss Karen Butler. Oh, yeah. Thanks for coming, Karen.
I'm glad to be here. Thanks for
Wow.
having me.
Now, hold on. The great things in the community, but that's one heck of a responsibility. Chief Officer of Northeast Ohio Neighborhood Health Centers. That means you got a lot of people's goals, hopes, dreams, and aspirations of having great health on your shoulders.
Absolutely.
First of all, take us back to the beginning, Karen. You know, how did you even get involved in this type of work?
Yeah. You know, this has always been my passion, you know, having the opportunity to serve other people, having the opportunity to see what I could do to help improve other people's lives. That's what drove me. And healthcare has always been a thing with me, even as far back as I can remember. So everything just kind of worked out to kind of guide me and lead me along this path.
Right.
And really, I feel like this is what I was put here to do.
First, were you ever in the healthcare field as like a registered nurse or anything like that?
No, I've always been in kind of like that area of administration, but it's interesting that you asked me that because initially that's kind of the direction that I was heading in.
When you were a young woman coming up, you wanted you were having aspirations going into the nurse?
Yeah.
So the medical field intrigued you at a young age?
It did. It really did. And so I kind of found myself going along that path and decided that, you know, I wanted to prepare myself in order to be able to do this work.
Right. So, okay, you got out of high school, ended up going to college. What was your major?
So I majored in healthcare administration. In my undergraduate work was at Case Western Reserve University. So then I did a little work at university hospitals in the emergency room, and I had a really good supervisor.
Hold on. Did a little work. Look how she glanced over there. Did a little work in the emergency room. Look, it ain't nothing. Did a little work in the emergency. No, ain't no such thing as little work in the emergency room. That's an emergency, okay?
Emergency.
Wow, that's huge.
That's right. And so that's what really got me interested in how healthcare organizations worked. And then so from there, I went to University of Cincinnati. And again, I got my graduate work in the administrative area in healthcare, planning and the whole 9 yards. So it really helped give me that foundation, you know, in order to be in a leadership position in healthcare.
So tell me, when you were young coming up, you didn't have no problems going to the hospital, getting the flu shots, all that. And then you were impressed by the white coats and all of that.
And all of that stuff, you know, and it's funny because I think that really helped to shape my dream. And you said going to the hospital, getting flu shots and all those things, because even in the work that I'm doing right now at Neon is all about prevention. So our feeling is that if we can assist our patients, if we can support our patients, if we can help our patients to maintain their health, to prevent illnesses from progressing to the point where you have to go to the hospital, we know that that's one way of keeping not only our families healthy, but our communities healthy.
So hold on. So let me get it straight. It sounds like at Neon, you guys do a lot of blood screenings.
We do all kinds of screenings. We do. So the services that we provide include everything. We like to consider ourselves a one-stop shop because you go to Neon, you can get adult medicine services. You can bring your kids in for health care. We have dentistry. We have optometry. We have podiatry, laboratory and x-ray. When you talked about blood screenings, we do that. We also have transportation services. We do nutrition services. We have behavioral health, and we have a dynamite outreach program with a dynamite coordinator.
I had always thought in my ignorance that Neon was totally for the women. It was a women thing. Is it women and men or what?
It is women and men. See, and I'm glad you mentioned that because one of the new initiatives and major initiatives that we have underway now is to reach out to the men. We've got some excellent administrators there who are putting together programs that target men. There's one that we're getting ready to launch right now. It's called Dad's Reach. And basically it's designed to support, empower, and encourage men to be examples in getting their health care for their kids. And that started out because at the health centers, we began seeing a lot of single dads bringing their kids in for care. See, so we want to encourage that and support that. We have what's called Daddy Boot Camp, and that's for new dads, where we have a group of men who can talk about what it means to be a father, can talk about those things that will help prepare them at the health center. Yes, we do. Yes, we do.
Wow.
Yeah. So the point you raise an excellent point. We have lots of services for women, but we don't want to leave the dads out, the men out, because that's what creates healthy families.
Now let me ask you, Karen. Now, how did it become where you became the chief operating officer? How did that journey come about?
Okay, so let's see. Like you said, going back, my time at Neon actually started about 20 years ago.
Wow.
Yes, it did.
Hold up. This ain't rookie business. I ain't just get put on, okay? Because I got the pretty face, all right? This ain't no pretty face business. This 20 years.
This 20 years I've been around. As a matter of fact, Neon started in 1967. So that means for over 50 years, we've been out here in the neighborhood. We've been out here in the community. And it makes us really one of the oldest community health center networks in the country. We're one of the largest too, because we got 7 locations and we do all kinds of things. We got a mobile dental van. You know, we go out into the community, the nursing homes. We got an in-school program at Shaw, you know, and we really do all these things. So when I started back about 20 years ago, Neon was right at the point of expanding. We started out with 2 health centers, but then in 1985, we opened up 3 new facilities all at the same time. I started out the one at 131st and Miles. I was the founding director out there. Just make everything that involves, you know, open up a health center. That means hiring. That means setting up the design of patient flow. That means bringing your doctors in, all of that, you know, designing the space. So it was really a good experience, and it really helped to shape my passion for dealing with and serving the community. So I did that for a number of years, and then Mayor White contacted me. His office contacted me. He said, "We need somebody like you." So he asked me to come down to the city and be the Commissioner of Health for the city of Cleveland.
And so you served as the Commissioner of Health
for the city of Cleveland.
Wow.
Yes, I did.
Hold on. I want you to fathom that. Served as the Commissioner of Health for the city of Cleveland. Wait a minute. Doesn't Cleveland have one of the top hospitals in the world? Like the number 4 hospital in the world? Cleveland. And here you are, the health commissioner
for the city of Cleveland.
Wow, that's having a lot of confidence in your abilities.
Yes.
What do you think attracted you to the mayor and these parties where they wanted to reach out to you?
I can tell you. So when I started that center, Southeast Health Center, 131st and Miles, I had a vision for it. So yes, I wanted it to be a place where residents can come and get their health care, but I wanted it to go beyond that. I wanted it to be a resource for the community. So that means, you know, connecting with the other merchants within the area. What can we do to make our community safer? And one of the things that I did was reached out to one of the high schools there, because what I wanted to do is bring the students in so they could see what we were doing, but more importantly, so that they could get exposure to the number of and the variety of health careers that they could go into. I mean, everything from finance and accounting and you name it, laboratory, x-ray, all of that. So what happened was, anytime that you have or trying to launch a program that involves kids, well, they have to come out to check the place out.
Right.
So they did that. And when they did that, I think they were just amazed at all the things that were going on.
All the work that you had
all
done,
the work. And I think that's what brought
expertise
me to,
you put into
it. To make it work, you see. And I mean, you know, when we opened it, the community just embraced it.
So when the opportunity came across, you know, Karen, you know, we like your style. We believe you can transform this. We believe you can do this. Okay, what was going through your mind at the time? Were you overwhelmed? Did you know you had this? Did you have a certain vision in your mind for what you wanted to do? Or what? How was it?
I did. And so, you know, as connected as I was and as excited as I was about the work that I was doing at Neon, I had to ask myself a question. So I said, okay, so here I am at Neon. Here they want me to go to the city. The question that I asked myself, what would allow me to do the greatest amount of good for the greatest number of people? And that's what made my decision.
Wow. with a lot. That's not a self-serving thing. That was thinking of other people. That's big. Now, one of the things though, Karen, since you've been in charge and have been the COO, the business has grown like about 30-something%, like 35%.
Yeah, that's right. So, you know, anytime.
Yeah, we like you, Karen. Yeah. Yeah, Karen, you're doing a great job. You're doing it big. Yeah, that's good stuff.
Saving lives, you know.
Right.
And see, and that's what it's all about. Because my feeling is, if you're gonna do it, do it.
Yeah.
Yeah, and do it big. So when I came there, you know, you look for opportunities for how you can make a thing better. So one of the things that we did, not just initiated, but we were able to conduct a $1 million renovation of our flagship facility, and it's about 99% done right now. The second thing is, so I looked around downstate, and they had all of these opportunities to support the operation. So I said, well, gee, we going after this? And a little hesitation, I said, well, we going after this.
Hold on. So it was a little pushback. You seen the vision.
I saw the vision. We can do this.
And
right?
you reached out to the powers that you reached out to the powers that be that surrounds you.
Right.
And then they were a little hesitant.
Yeah.
And how were you able to persuade them to go on with your vision?
I went and did it.
You went and did it. Took the initiative. Hold on, that's a great point that you brought up. So when people get into positions of power like this, especially people of our likeness, is that a thing that they need to take the initiative and not always wait on what to be told what to do?
You can't always wait, because you see, you wait, sometimes those opportunities will pass you by.
Yeah.
And I know this was a big opportunity for our organization. We needed to be a part of it. So I called the state, went online, completed all the paperwork, turned it in. We got submitted, and guess what? Those checks started rolling in.
So Karen, what did the higher ups say to you at that point?
Oh my goodness, they were excited too. Just that's the reaction that I got right there. That's the reaction.
And that had to give you a lot of wind in your sails to be able to close on business that will grow the business. And like you said, it's helping people fundamentally.
It's helping people fundamentally. And that's the thing. See, we need to do all that we can to strengthen our organizations, because the stronger we are as an organization, then the more we can do to strengthen our community.
What some of the things are you doing to combat, the weariness of going into medical centers and facilities? People, they don't want to know, they don't want to go get an AIDS test. They don't want to know results. They don't want to do none of this stuff. They're fearful of this stuff. And they might not go to the hospital, and then they might drive past and see a neon sign and be like, well, it looks more intimate.
It does. It
does. I don't know. So to speak to you speak to that arena of that.
Love that question, because see, at Neon, all of our community health centers are right in the neighborhood. All right. And it's people there that look like you and me.
Okay.
And so what we have is what I consider connection with the community. Why do I say that? Well, the reason is because we have families that have been there for like 3 generations. In other words, when we first opened up in 1967, we had our patients coming there. But guess what? When they had their kids, they began to bring their kids there. As their kids grew up, they began to bring their kids there. So when you can see families that started out with us, that are still with us, that makes a really big difference. And so we want to make sure that we provide the kind of services and that we connect with people in a way that makes them want to come back to us and that shows them that we care.
Doing it really big. I'm right here with the COO, Chief Operating Officer of Neon, Northeast Ohio Neighborhood Health Centers, and that's Miss Karen Butler right here. Now, before we went to the break, we were speaking on the things about Neon, and Karen, tell us a little bit about what Neon has going on in the community, about some of the things that the people already know about, and then some of the things they may not know about that's new.
That's great. So in addition to providing healthcare services at our community health centers, we also take it a step above that. We go to another level. And so what we do is we address what we call the social determinants of health. And that's these other factors that impact people's health. So for example, we know that literacy, and you referenced that earlier, is a very important factor. So literacy translates usually into economic potential, which then equates to and impacts health outcomes.
Yes.
So one of the things that we do at Neon is we provide free books to all of our children 5 years and up. When they come in for their healthcare visits, we give them free books. We encourage their parents to read to them, read with them, so that way education can become an important and valued aspect of the family life.
Whoever came up with that concept right there need to be celebrated for having, vision. Being forward thinking, and I believe Karen got a lot to do with that right there.
We got some great people there.
Okay.
Another thing is when you think about housing. So if you have struggles with housing, you don't have a proper housing, the last thing you're thinking about is your health care. You
Yeah,
get
got
a
that
roof over
right.
your head, right?
Right.
So one of the things that Neon initiated was we identified a property. It was a large townhouse. It had been in the neighborhood for many, many years, but it was in disrepair. So Neon got together with other community organizations, other political leaders, and what we're able to do is renovate that property from top to bottom, and we were able to bring in homeless veterans and their families so that they can have beautiful facilities to live in. And guess what? It's right across the street.
Oh!
They can get their health care.
I love that. Before all this, I didn't know what to think. I just thought it was like a money grab. I thought it was like type of healthcare where you come in, sit down, and shut up, and here we're gonna stick this in your mouth.
Yeah, nothing like that.
Nothing like that.
Nothing could be farther from the truth, because again, what we're set up to do is make sure that everybody has access to high quality primary health care. So if you don't have insurance, we will still take care of you. We will help you get insurance. If you have insurance, fine, come on, we'll still take care of you. But again, we have certified application counselors who work with our patients and get them connected with the resources that they need. That'll help them not only for that one visit that they came there to get, but throughout their
Real
life.
quick, what's a prerequisite to have to be able to get services from Neon?
Yep, no prerequisites. Like I said, if you don't have coverage, come on in. They may ask to bring a demonstration of income and family size. We'll do that. We have a sliding fee scale. Whatever it is that you need, we can provide that for you. So just come on to any one of our sites. You can make an appointment. We do walk-ins. We do all of that. And if they want to reach us, phone number.
Yeah.
Hey, how you doing? My name is Real from the Playa T show. I just want to know what the difference is between the welfare healthcare plan and your plan versus when a person has a job, you have to pay for healthcare. So what's the difference between those three?
Okay, so what I think you're referring to is like Medicaid services, right? So they provide an array of healthcare services for you. You can bring, for example, your card to any one of our Neon sites. We'll get you signed up and you'll be able to get healthcare services. Let's say you're working on a job and you have insurance coverage. We will also accept that. Let's just say you're working, but you don't have insurance. All right, we can help you with that too. I mentioned the sliding fee scale. We have that. So what we can do is rate you based upon whatever your income is, whatever your family size is, and then we can make sure that you get the healthcare services that you need.
Oh, if you want more information about Neon Services, you can go to their website. We want to thank Karen for coming on board,
It's my pleasure.
And revealing to us the great things that Neon has in the community. So we thank you for coming on.